Now let's take a look at the complete BLS sequence for one rescuer with the initial assessment followed by cycles of compressions and breaths. Just watch now. You'll have a chance to practice all these steps together momentarily.
Hey, are you okay? Activate the emergency response, grab the AED. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
For some healthcare providers and other rescuers, a two-person or team rescue is far more common. In two-rescuer CPR, each rescuer has a specific role. Rescuer 1 should be positioned at the victim's side. It is Rescuer 1's role to perform chest compressions, counting out loud.
1, 2, 3, 4.
You have already learned the proper technique for compressions.
9, 10.
Rescuer 2 should be positioned at the victim's head. It is Rescuer 2's role to maintain an open airway and give breaths with a bag mask while watching for chest rise and avoiding excessive ventilation. Rescuer 2 should also encourage Rescuer 1 to perform chest compressions that are fast and deep enough and to allow complete chest recoil between compressions.
7, 8.
Remember, push hard and fast, at least 2 inches or 5 centimeters. His chest needs to fully recoil between compressions.
5, 26, 27, 20.
As you are aware by now, giving good compressions can be very tiring. So in a two-person rescue scenario, it's important to switch roles about every 2 minutes to prevent fatigue. Every time the AED tells you to reanalyze, switch roles. If there is no AED present, switch roles after every 5 cycles of CPR. Now you know how to perform two-person rescue. But let's review some key points. The first rescuer performs chest compressions and counts out loud. The second rescuer maintains the open airway and gives breaths. The compression rate for two-rescuer CPR is at least 100 compressions per minute. The compression-ventilation ratio for adults is 30:2. Compression should be paused when giving breaths until an advanced airway is in place. When performing CPR without an AED, rescuers switch roles about every 5 cycles to prevent fatigue. When an AED is present, switch roles every time the AED tells you to reanalyze. This switch should take less than 5 seconds, minimizing hands-off time. The rescuer giving breaths must monitor the chest compressions that are being delivered, encourage the compressing rescuer to push at an adequate rate and depth,